Today we're going to speak about the selling advantages of the Statodyne supinator pronator with radially based cuff. We're going to start distally on the device and work our way proximally. On the very distal end of the device, we want to take note that this is a Statodyne product, which gives us the advantage to choose either a static progressive tissue elongation mode or a dynamic tissue elongation mode. What we are seeing most clinicians choose is the static progressive mode in various parts of the country, probably because of the main driver of decreased wear times. Our protocol is 3 60-minute sessions. You can think of that as being 12 5-minute treatments. On a 0 out of 10 subjective pain scale, as far as stretch is concerned, we want the patient to land that stretch in a range of around 3. So every 5 minutes the patient is going to do one of 3 things if they're using the device in a static progressive stretch mode. If they are above a 3 after 5 minutes, they're going to decrease the amount of stretch being applied by the device. If they are at a 3 after 5 minutes, they're going to leave the device in the same place. And if they're below a 3, they're going to advance the amount of stretch for increased tissue elongation with the device. The advantage of having a dynamic mode on the product is that as the patient heals, some patients run into a time scenario where they cannot get that last session in during the day, and the low load prolonged stretch or dynamic mode of the device may come in advantageously in the fact that they can flip this switch here, and now the device can be utilized in the dynamic fashion where they could actually sleep in the device and get some valuable TERT time at rest. I don't think the patient would sleep the entire night through with the device on, just from a comfort standpoint, but the advantage of having both modes of tissue elongation certainly bode well for the product. In addition, there are different pockets in the country where some insurance companies pay for static, some insurance companies pay for dynamic. We can capitalize on a single device for both modes of tissue elongation. When speaking to clinicians or physicians, the advantage of having both modes as well is the fact they do not have to have a crystal ball when they're palpating the patient's, let's say, elbow, and they're trying to determine what the patient would glean best from, either static progressive because maybe the end feels firm to hard, or maybe dynamic if the end feels a little bit more pliable. Coming back just a little bit more proximal in the device, this device actually has infinite range of motion. And one of the issues that we are seeing across the country is that there are different supinator and pronators out there where the arm would be rotated and the device would say that it was in 90 degrees of supination or 90 degrees of pronation. However, because of soft tissue give, whether in the forearm or whether there was soft tissue give proximally because of low tone, maybe because of a nerve injury, or maybe the patient had some atrophy, or maybe just because the patient had a lot of soft tissue give proximally, the forearm was truly not at 90. And we call that device bottom out. So the beauty of having a device that goes well beyond 90 degrees is if I have some soft tissue give here proximally, or some soft tissue give here, more proximally in the tricep and bicep area, we can truly achieve 90 degrees of forearm rotation in both supination and pronation. Now our decal does go 0 to 90 in black, and then from 100 to 130 in red, to let the patient know that they're starting to get outside of anatomical norms. And if necessary, if you want to protect the patient with a zip tie through this rotatory bar here, as well as through the base of the device, we can actually create anatomical blocks so the device won't go farther than you deem clinically appropriate. Especially on the patient that might be what I call a type A ultramarathon or no pain, no gain type patient. You can gauge that patient's either low load prolonged stretch or static progressive stretch as they progress through their rehabilitation protocol. Moving a little bit more proximal in the device, one thing that you're going to take note of is that this device has a radially based cuff on it. This is newer technology in the marketplace, and the fact that the other supinator pronators in the industry use what is known as an ulnar-based cuff. Even our device used an ulnar-based cuff initially, where you kind of karate chop down on the cuff, if you will. Because the ulnar bone is a stationary bone and the radius is a rotatory bone in your forearm, we found to be a pilot study, that applying the cuff on the radial side of the product allows the form to rotate with less torque output needed. So the beauty of that is that you can actually rotate the form with more comfort and therefore more compliance. It's a more anatomically correct rotation. Even though our device does a very nice job rotating the form anatomically correct, we also wanted to take time to avoid what many clinicians call carpal torsion, whereas the carpus would rotate, but the radius would not. And what we've done here is we've captured the forearm very well with what we call a 3/4 cuff. So not only do I capture the forearm here 3/4 of the way circumferentially, but I also capture the forearm well 3/4 of the way longitudinally. So essentially I eliminate carpal torsion, and I allow the device to rotate the radial head, the proximal joint, as it should be rotated. This is also mimicked in therapy. When we're working with patients, we'll stabilize the ulna and then we'll rotate the radius. Moving a little bit more distal on the device, one thing we should take note is if you have a patient where you want their fingers in full extension, you certainly can do that. These two screws can be loosened on the device and the cuff can slide more proximally. These two screws can be loosened on the device and the actual frame can telescope out more distally. We had a patient who had a PIP flexion contracture, had a volarly based splint, keep their PIPs in full extension, and they were allowed and able to wear the device with full finger extension by telescoping the device in that fashion. Another thing to take note is if you have somebody with stiff PIPs, we have had patients who've had flexion gloves on, and they've actually had their flexion glove being pulled down here with a piece of additional Velcro, and the device worked on finger flexion during forearm rotation. Coming back most proximally on the device, we'll also notice that we've got a very good soft tissue capture on the bicep and the tricep because we want to have good proximal stability for adequate distal mobility. And that's why we use a custom cuff here on the proximal end of the device. Looking at an anterior view of the device, I will now rotate the device into full dynamic pronation, and right now the device is at 120. You can probably appreciate how the device goes beyond 90 with this anterior view. I'll now rotate the device into a full supinate position so you can also view from an anterior viewpoint how the device can go well beyond 90 if necessary due to soft tissue give. Now, although the device looks like it's in static progressive mode, it's actually in a dynamic mode. As you can see, I can actually override the spring, and the spring is going to bring me back into full supination. The advantage of that is if you have somebody who has some nerve entrapment during a certain degree of forearm rotation, they can either override the device, as I am now, by utilizing my involved extremity, if you will, allow blood flow to get back to, let's say, the interosseous membrane, and then when I relax, I can go back into full supination. Or if I'm not that strong, I can actually reach over with my uninvolved extremity and pull on the device and allow blood flow to get back to my soft tissue. However, if I have a patient who's more rigid in nature, or perhaps they're not responding well to the dynamic low-load prolonged stretch mode, I can simply flip the switch here, and now the device is truly into a static progressive mode, where I cannot override the spring, and I cannot manually move the spring either. And I can go well into 90 degrees plus of range of motion.